So welcome to Doc Talk Live. Chad, all I see is your chest. That's better.
That's what you want to see.
I just want you to see my hair. That's all I want you to see.
Hair's amazing. I've got my cap ready to put it on whenever you're ready. So just let me know.
I left my Santa hat out.
So we will post this. We'll post this later. So this is not live. But we are talking about this medical education combine that you guys are doing next weekend in Dallas, correct?
In Fort Worth.
And the education y'all are doing is on spine, and you're going to be showing the latest and greatest inventions in minimally invasive spine care. Is that right, guys?
Exactly.
And, you know, I really think this would be a great talk for those investors out there, because all of these companies that you guys are working with are not publicly traded. So if they ever became publicly traded, this would be like, oh my God, you heard it here first. These are like the up and coming companies that are under everybody's radar. So as I recall, you're going to be working with Relievant. Yep. You'll be working with Spinal Simplicity, which make products to treat back problems. You're going to be working with a tech company that lowers the radiation when we do procedures. What's that called?
Control Rad.
Control Rad. You're going to be working with a company that immerses the experience, like a three-dimensional experience. So you don't even have to go to a meeting. You put these goggles on and you're there.
And that's the best part of it in my mind, is that company Immertech lets you be in the OR with us. You know, not just these times of COVID, but it gives you the opportunity to be right next to us, see like you're right at the end of the table without having to be there. It's very impressive.
And so what would be nice is have I missed any other companies you're working with?
Yes, StemWave is going to be there representing peripheral stem. We're going to teach how to do superior cluneal nerve stimulation, which should be great. Medtronic is going to be there representing spinal stimulation. And excuse my lighting, sorry.
Yeah, well, Medtronic's going to be doing the DTM, their brand new type of spinal cord stimulation. We're going to have Biotross there, which is a new inventive way of working on cadavers that are not actually cadavers. So they feel, they react, in my mind, better than cadavers. And it lets you be able to see the anatomy through a C-arm, be able to see the anatomy through the gel, and perform any procedure you want. It's great for practicing residents and fellows and for docs learning new procedures like this.
So if people are watching this, yes, try to look up all these companies. I'll try to hashtag
There's another
them.
one.
Pardon me?
There's one more. We can't leave anyone out.
Go ahead, Anthony.
Eloquence too. They'll be doing the Disc FX procedure. I actually think of you a lot with this one because you taught me how to do the disc approach. And they do the percutaneous discectomy or percutaneous, maldiscectomy.
But go ahead and when you guys do this next week, it'd be good if you did a Doc Talk takeover, such that if people know to ask questions about the lay people, to ask various questions about back pain and maybe which procedure would be most appropriate given certain clinical scenarios. That might be pretty cool.
Yeah, I think that's one of the biggest things for doctors too. With all these new procedures, we see them at conferences or we see videos of them, but I think a lot of people are concerned of which patient is right for each procedure. So that's one of the things we try to do with this MedEd Combine is we go through, we're going to be going through 6 procedures and kind of some of them are similar in a way, they're all treating back pain. So when do you use which one is one of the most important things. We don't expect you to come out of this medical education combine proficient in doing the procedure, but you'll know that 1, you're able to do it. It's not that daunting. And 2, you'll know which the patients you already have in your office. So especially for, people that haven't been doing these more interventional procedures, this is a great way to get started.
Now, will anybody
For the
be
people
there
that's gonna be
live
there-
besides the companies, or
Yeah,
is
that's
this
what I was
all
gonna
going to be
say.
online?
There will be company representatives here. And so that was what I was going to say is Anthony's already hit on one side of this, which is the doctors are going to benefit hugely from this experience. But if you think about the kind of money that companies put out to be at a NANS meeting or at some other meeting, only to have a couple of people walk by and have a cup of coffee with them, it's really cost effective for them to be part of this kind of a combine, because we can showcase their device with either Anthony or I, demonstrating or asking questions to a person of their choice. And they can, in a very short time, 20 or 30 minutes, get all kinds of people on these Immertech goggles, all these people on the Zoom call, all immersed into this technology, instead of just waiting at a booth and hoping somebody comes by in between meetings when they don't really even come. So this is, make no mistake, for the doctors to get exposure to new procedures and to learn what they can add to help their patients. That's primary number one, why we're there. But number two, I think it is a good chance for the people from industry to come and talk to one another and talk to the different doctors going to be there. We're going to have some other experts there. We need you there, Brad. I understand you have a commitment we can't get you out of. Next time we'll get you out of your commitment ahead of time. But the fact is, I mean, all of us being there together, sharpening one another, is what makes this so fun. And the same thing's true of the reps. They all get to say, well, I'm in Nashville, Tennessee. Well, I have doctors in Nashville, Tennessee. Let me introduce you to so-and-so. And it becomes a big networking, group webinar, basically.
All right. Well, we'll get this posted on Doc Talk. And again, I want you guys to try to do a Doc Talk takeover if you can sort of make time for it while you're there. Okay.
For sure. I think we'll be able to. I don't know. I mean, we're streaming from 12 to 3 on Zoom. The VR headsets are gone, but I think we should do a Doc Talk takeover maybe beforehand and show kind of a little behind the scenes what we're doing. And for those people that have missed out on the VR headsets, we're on Zoom. We're able to take up to 500 people. We're hoping for 100, and we're already over 150, almost to 200. So sign up for the Zoom. You'll still be able to see the CRM images and the PowerPoints that we're going to put up. Everything's going to be overlaid. It's going to be great via video for you guys. So definitely check it out.
Perfect.
So Anthony, the question comes up: if we do 25 VR, headsets, why aren't we doing 200? And the reason is, I asked this very question because I'm like, we have a bunch of people interested. So next time the take-home message is sign up early, because there's a certain amount of confidence in the experience somebody will get with a certain amount of headsets. And the more headsets they get, the more uncomfortable they are that somebody won't get the same experience. So I think, and correct me if I'm wrong, Anthony, but isn't 35 or 40 like their sweet spot for the most they feel comfortable with right now?
So far, it's all a bandwidth issue.
Right. It's going to get better.
Tech guys out there, they're just going to keep getting better. We're hoping for 50 at the next one. And I hope they're watching this, because that's what I want them to push for.
We can get as many, we'll fill up as many headsets as you'll give us. How about that?
There we go. Exactly. And I think we've proven that. And for the next one too, just so everyone knows, we are going to have CME credit and everything. So this is really going to start rolling for the docs and for the companies. It's the best way to get your stuff out there.
Awesome. Thanks for doing